Hi, I'm Paule Pachter, the President and CEO of Long Island Cares, and welcome to another episode of our Breaking Bread show right here on YouTube. Breaking Bread is our opportunity to talk to you in the community about what's going on in the nonprofit space here on Long Island, and always talking about the issue of food insecurity. We're very happy that Breaking Bread is sponsored by New York Sands. New York Sands is creating an entertainment, retail, and hospitality destination in the heart of Nassau County. Looking forward to all the excitement coming to Long Island through New York Sands. New York Sands, welcome to the neighborhood. And I'm so happy to welcome my guest on this episode, a good friend of mine, a good friend of Long Island Cares, and an exceptional leader within the human services space, my good friend Vanessa Baird-Streeter, who is the president and CEO of the Health and Welfare Council on Long Island, and we're going to get into a discussion with her. Vanessa, it's so good to have you here, finally.
I know, finally I'm here, and thank you so much for extending the invitation.
Well, thank you so much for accepting it. So, for those people that don't know, what is the Health and Welfare Council of Long Island? How did it start? And what's your mission?
So it's funny because when I say I'm the president and CEO of the Health and Welfare Council, they're thinking of, a grouping of individuals that are sitting at a desk. So the Health and Welfare Council was started in 1947, so we are 77 years old. And really, it is a health and human services focused organization. So there are a couple of things that we do. First is there is direct service. So we provide direct service to constituents in both Nassau, Suffolk, and some in Queens as it pertains to food insecurity. So whether that is assisting, doing outreach as it pertains to the Supplemental Nutritional Assistance Program, or actually doing pre-screenings for the program, or actually helping people complete the application. And I think those three perspectives are important because sometimes when people are filling out an application, particularly for SNAP, it feels like it goes into the abyss. They don't know whether they're eligible or not. So the pre-screening really is helpful to that individual so that they don't have their hopes up and not really meeting the eligibility requirements. And then in reference to helping them complete the application, that is helpful to our local departments of social services who are going to be processing and approving the applications. We want to ensure that they are complete. All supplemental documentation is a part of it as well. So that is just helpful for our entire region in making sure that these applications are complete so that it's easy for the departments of social services to be able to approve. And then we help with health care and health insurance enrollment in New York State. So we help with New York State Marketplace, and we really help to provide people the opportunity. And when people realize that there is, based on their income, when they realize like they can have affordable and quality health insurance for a discounted rate, that is just something that really overjoys them. So that's part of some of the direct service that we're engaged in, but we also are an organization that's an umbrella organization, an advocacy organization for all of the nonprofits on Long Island. So that's coalescing around particular issues, concerns that we may have as nonprofits, and what rises up to prioritize and advocate for on the state, regional, and national level. And we have a variety of different initiatives that we're engaged in. One of the new initiatives, and maybe I won't get into that yet because you might ask me about that, so I won't share that right now.
Most probably.
But, and then we have a board of directors who are made up of nonprofits as well, leaders of nonprofits. And I think that's so important because our board of directors is helping to guide the mission and the goals of the organization, and coming from nonprofits and leading nonprofits really helps to ensure that we stay on the track of really serving really the most vulnerable residents within our community and our most vulnerable community members.
And it really is critical for those of us in the nonprofit industry here on the island to get together with each other as frequently as possible to talk about the challenges that we each see. It never should be about competition. It should always be about collaboration, working together, especially when it comes to advocacy. And I'm just amazed because sometimes I forget 77 years is a long time. I mean, that's a lifetime for some people. And, the commentary would be after 77 years, what have we been able to achieve? How different it is? And, I always look at it, Vanessa, as we achieve a lot, but then every year, every other year, there's a whole bunch of new challenges
Absolutely.
that are coming forward. You know, we haven't spoken about food insecurity in the way we're speaking about it now for decades. You know, Long Island Cares was established nearly 45 years ago when it was estimated that there were 50,000 people on Long Island that needed help with food. And we were able to open up on the grounds of Pilgrim Psychiatric Center. Most people know the story. And here we are 44 years later, and the 50,000 people have become 225,000 people. And with a network of more than 350 organizations that just deal with food. And of course, there are 2 or 3 very large organizations, such as Long Island Cares and Island Harvest and the Interfaith Nutrition Network, everybody working together. So that brings me back to the issue of SNAP, because there's been so much reported in the paper lately about the Supplemental Nutrition Assistance Program and people having a biased view towards what SNAP benefits are. So if a family gets $60 a month to supplement their food purchases, oh, we're doing enough. No, not with the price of food going up by
Absolutely.
17%. I also know that at our 5 satellite locations that Long Island Cares operates, that your staff has been critical partners with us, doing the SNAP applications, working with us in terms, as you mentioned, to get people health insurance through the Affordable Care Act. You know, people talk about Obamacare, the Affordable Care Act. What is it doing? Well, it's helping tens of thousands of people on Long Island who can't afford to take out a policy with a commercial insurance company and pay, you know, $700 a month for an individual plan. So what do you say to the critics who criticize SNAP benefits and this is a waste of state money and not everyone who deserves this is getting it, and people are, you know, gaming the system? What do you respond to that?
Nobody wants to game the system
Sure they
to
don't.
get food. You know, I would love to be, anyone wants to be able to provide for their family. So nobody's really trying to game the system to try to get access to a couple of $100s per month. They need it. And particularly on Long Island, because our cost of living is so high, when we look at the federal poverty levels and we look at what is allowable for eligibility, you can't exist on Long Island making a family of 4, making less than $50,000. We know that it takes, based on analysis, it's about $120,000 for a family of 4. So to me, I think what's most important to the critics is these are hardworking people that have 2 and 3 jobs sometimes that are trying to make ends meet. They want to ensure that they have food and nutritious food on the table for their families, but it's not anything that it's just a handout. People need it. And as you said, with the cost of, the cost of food increasing 17%, people need the assistance. And that's why it's so important. In addition to SNAP applications and opportunities, free and reduced school lunch for everyone, lunch for everyone. We don't know, and even in affluent districts, there are a lot of times there are lower socioeconomic levels that cannot. So at least knowing that my child in school is going to have access to 2 meals, that helps me as a parent, because now I'm really responsible for 1 when they get in my home, right? Or on the weekend, I'm responsible. So I think that it's multi-pronged when we're looking at those that are food insecure. The food banks are so important and so critical to helping to supplement, because the SNAP benefit is not enough.
No, it's
not enough for the month on a monthly basis. But then I can have access to a food pantry and go into a food pantry and access some of the resources that I need for my family. But at the bottom line, people want to be able to provide for their families, and some just cannot with the high cost of living in Long Island. So just know that a SNAP benefit is much needed, and nobody's really trying to game the system to
and
get
we
a SNAP
also
benefit.
know from our own research that 40% of all of the people that are utilizing the services of a food pantry are Long Island families that are working 2, 3, maybe 4 jobs just to get by. So the little extra that they get from the SNAP program really helps out. And then, of course, they have to go to a pantry to do fill-ins. And as more and more of the food banks and the pantry are working with fresh produce and fresh proteins and all these other kind of products, people are coming and using the system the way it was set up to be. And we also saw during COVID that this 221,000 number doubled especially here on Long Island. And I think the reality for many was that Long Island is not as wealthy as people think it is. The majority of the people living in Nassau and Suffolk County are living paycheck to paycheck. And you said it correctly, there are pockets of affluence here. You know, one of the things that we've been advocating for now for at least a decade is for the regionalization of the federal poverty level.
Absolutely.
You know, when you say that the federal poverty level can't continue to be a one-size-fits-all program, the, $30,000 or the $40,000 that a family of four earns in Long Island is very different than the same family living in Alabama or South Carolina or Arkansas or anywhere else. And there is legislation now in Congress to regionalize the federal poverty level. And I remember having a conversation with former Congressman Steve Israel about, 8, 9 years ago when we first proposed this. And he said, Paul, that would bankrupt the government. I said, no, it wouldn't. Why would it bankrupt the government? To give more money to New York or Massachusetts, New Jersey, California, it's just leveling out the field. And what you're trying to do is saying to people, well, if you can't live with the income you have on Long Island, move. That's not the answer. Not for people that have families and loved ones and friends here. So that's one of the issues we're looking at very carefully. But what are the issues right now that the Health and Welfare Council is looking at in terms of the network and advocacy? What do you guys want to see?
So I think one issue that's extremely important and near and dear to my heart is Black maternal health. New York State just recently had a report. They had convened a group of experts from across the state, and they issued a report just talking about Black maternal health and maternal health in general, and how Black women are 3 to 4 times more likely to die during childbirth or postpartum. I think, we're living in our society, it's the United States, and those are numbers that we should not be seeing or experiencing. So that is a particular issue since I've come on board at the Health and Welfare Council that we are coalescing around, bringing together some nonprofits that have been in the space, and really looking at the opportunity to really empower and educate the birthing parents and their support network, because that's really important. You have to be able to advocate when you're in front of your healthcare professional. If you're talking about you have pain and they're not paying attention to it, you have to continue to advocate for yourself. I think the other piece is advocacy. It's advocacy on the state, regional, and national level for opportunities for funding for consortiums like this to really come together so that we can educate the birthing parents, support systems and network. We can advocate, but then also it's working with our health systems, ensuring that if there is implicit or unconscious bias as it pertains to the providers, that we unearth that, because we all have biases and it's okay, right? Like I have biases, I'm Black, I have biases, right? We all have it, but unearthing it and realizing that maybe that is a framework in which I operate will allow me to listen and open the lens to allow me to listen to a woman who is saying they're feeling pain, but I'm not really prioritizing the pain that they're feeling. And hence it ends up being something that is not contributing to their health and safety. And then also with our hospital systems, also just realizing that if a person has a doula or a person has a midwife, it's not an adversarial environment, it's actually a very complementary environment, because that doula can come with them to their appointment. They can advocate for them. Sometimes people feel uncomfortable. I'm in front of a medical professional and the doctor is using words that that don't resonate with me. So then I don't want to say what I'm actually feeling. So I think it's a couple of those pockets. The education and empowerment of the birthing parent and support system, the advocacy that needs to take place on the local, regional, and national level, and then us working with our hospital systems to uncover and train as it pertains to implicit and unconscious bias, as well as this is not adversarial in reference to additional assistance that families can have as it pertains to the birthing of their children.
And I think, you're pointing out something that's really important and I think critical, and that's when it comes to healthcare. The health systems that we have on Long Island are quite good, and everyone will attest to that. But you really have to start with the patient, and you really have to understand the culture that the patient is coming from. If you go into an emergency room, God forbid, you need treatment, and you just see the diversity of the people that are in the emergency room. And to be able to, talk about the need for doula services or midwife services, that shouldn't be threatening to the healthcare system. That should be, this person has extra support that we can provide for them. One of the things that I'm encouraged about, and I know that you're involved in this, is the new 1115 waiver program. If somebody told me 10 years ago that we could get reimbursed by Medicaid for providing food assistance, but, in the last 2 years, the health system has finally come to the realization that food for many is medicine. And we have a wonderful partnership with Catholic Health Services where we're providing food in their emergency rooms, because there are people that come into the emergency room who may be ill, but they're not in a crisis. And some of them are there because they haven't eaten in 3 days or 4 days. Hopefully they have, but and so we're working with the hospital to address that in the emergency room. So in your impression, what does the 1115 waiver bring to Long Island? Because that's an opportunity to get everybody together.
Absolutely. So, the great thing about the Health and Welfare Council is even though the 1115 waiver application came in January, they have been preparing for the last 5.5 years, bringing community-based organizations together, helping to build capacity of community-based organizations so that when this waiver came, we would be prepared and ready. So for the 1115 waiver, it is addressing the social care needs of 730,000 Medicaid lives on Long Island. And I think that's important because that allows us to holistically and comprehensively address our Medicaid recipients. There's one thing of going to the doctor and I'm getting, the doctor's checking me out and asking me about my health. But if I don't have the social care needs taken care of, my health probably will not improve. If I don't have the food that I need, the transportation to the services that I need, my health will probably not improve. So I think this is a unique time frame within our history of looking at it and looking at it from the community-based perspective, not just the health systems, but our community-based organizations that are the boots on the ground, providing the resources and the services to individuals. Now, when I come into a community-based organization and they screen me for social care, I feel they're a trusted messenger. They're a credible messenger. I have a belief in them. So therefore, I'll participate in the screening. And then I also believe that the services that they're going to provide to me are going to be adequate services and not, give me the runaround. And I think that's another piece. This is a closed loop referral service. So not only is the community-based organization screening you for social determinants of health and what are the social care you need, but then they're providing the referral, and they're not giving you a piece of paper and telling you to call this number. They're providing the referral. Then they come back to you to ensure that that referral has been taken care of and you have received the service or the resource that you need. The closed loop system is extremely important as it pertains to this process, but we're on the precipice of something major within New York State, and there are 13 regions within New York State that will have social care networks. And for Long Island, and it does speak to the work that the Health and Welfare Council has been engaged in for Long Island, we were the only region that did not have competition as part of the application process.
That says a lot.
So it says a lot to the work that has been done, the groundwork that has been done.
And it's very reminiscent, and I know we're running out of time, it's very reminiscent of what we were doing in the mental health system in the 80s with comprehensive community care and case management. So we have a lot to look forward to. And I hope we'll get time to have you come back on the show. It's been an absolute pleasure. My guest has been Vanessa Baird-Streeter, the President and CEO of the Health and Welfare Council on Long Island. If you want to know more about what the Health and Welfare Council does, they can visit you online.
They can visit us
online.
And the
website is?
www.hwcli.com.
HWCLI.com if you need more information about the Health and Welfare Council. Thanks for tuning in, and if you like what you see, please subscribe to this very program right on YouTube, because we're happy to talk to you and happy to get your feedback. And once again, we want to thank our sponsors, New York Sands, for being so generous with us and sponsoring this program. Until next time, this is Paule Pachter, President, CEO of Long Island Cares. Go out and do something nice for someone. See you next time.